For our second block, we have two fantastic presentations. The first one will be on the relationship between structural violence and food security, and will be presented by Dr. Chelsea Singleton from Tulane University. The second presentation is on developing a disaster food security measure, and will be presented by Dr. Lauren Clay from the University of Maryland at Baltimore County, and Nadia Koyati from the University of Buffalo. Then Dr. Marianne Chilton, a national expert on food security, will discuss. So Chelsea, welcome. The floor is yours.
Thank you so much. I'm just gonna load my slides. Okay, so hopefully everybody can hear and see me.
Yes.
All right, great. I'm so happy to be here kicking off the second session of this wonderful event. The presentations from earlier in the first session were fantastic, and I think that they lead, very well and segue very well into what I'm going to be talking about today, which is my project. Happy to be serving as PI of this particular project, focusing on structural violence and food security, building a framework to expand research and measurement. And again, I'm Chelsea Singleton, and I'm faculty at Tulane University in New Orleans. So first thing I want to do is acknowledge my wonderful team, my co-investigators, which includes Dr. Gabriella McLaughlin at Temple University, Mr. JJ Pianchi at my former institution, the University of Illinois at Urbana-Champaign, Dr. Angela Odom-Young, who's a faculty at Cornell University, as well as two wonderful research assistants we have working with us, Miguel and Christina, who have been very vital to this project, who are here at Tulane University in New Orleans. So I think based off the conversations that we had earlier in the first session, I don't think that I need to reiterate this, just because the prior speakers did such a great job speaking about, just laying the foundation of the fact that, we have significant food security disparities in the United States. And for decades, public health researchers and nutrition researchers have, studied and reported on food security and disparities in the United States. And we have several, prominent studies and research projects conducted, at the national, state, and even local levels that have documented disparities by race, ethnicity, socioeconomic status, education level, and even geographic location. So geographic location could be urban versus rural, or even disparities within a large urban center, because we all know that there is significant research that shows that, based off where you live, your zip code or what part of the city you might live in, if you live in a large urban center, your health outcomes and your nutrition outcomes might be very different than somebody who lives in a more affluent area. So eliminating these disparities continues to be a major public health priorities across various levels and in different health entities and agencies. However, one thing that I'm very happy of, being a young scholar in the field, is that in recent years, interest and consciousness around structural drivers of food insecurity in America has increased among researchers, health advocates, and policymakers. And I think that our consciousness and interest in structural drivers of food insecurity has increased for a couple of reasons. The first being the pandemic. So the COVID-19 pandemic has revealed, and even to a certain extent worsened, some longstanding disparities that we've seen by race, ethnicity, and socioeconomic status in various different health outcomes. Also, in 2020, we had nationwide protests against racial injustice in America, which, highlighted social and political in the United States. And that also highlighted and increased consciousness of structural drivers of food insecurity in America. And I'm happy because we're seeing more people taking interest in this. We're seeing more research coming out. We're also seeing more funding being dedicated to understanding structural drivers of poor health and inequities in the United States. So I think that segues well into what I'm going to be speaking about, which is structural violence. So let's start with the definition. So structural violence is a term that was conceptualized and made popular by a very well-known Norwegian sociologist named Johan Galtung. So his concept of structural violence is separated and different than, what we consider direct forms of violence. So structural violence is considered a form of violence where a social institution or a social structure causes harm to groups or individuals by preventing them from meeting their basic needs. Okay, so we all know that food is a basic need in life. We all need food to survive, and it's something that I truly believe everybody should have adequate access to, healthy, affordable food, regardless of their demographics and their identity. So when we're thinking about different institutions, cultural practices, norms, structures, whether that's laws and policies that are woven into the fabric of society that's preventing people from being able to, acquire food and consume a healthy diet, or that of their family and their community, then that, those are considered forms of structural violence. So institutionalized racism, sexism, and classism are key examples of structural violence. And structural violence is considered a driver of health disparities in the United States. So this phenomenon is well connected to social injustice in America, and it can perpetuate inequities. So I think that when we're thinking about, moving the field forward, when we're thinking about food insecurity, we need to be thinking about structural violence and its historical influence on various different communities and populations in America. So structural violence has been well studied in the fields of sociology and anthropology, which makes sense because that's, because of the natures of those fields. However, it's becoming a term that's being more used in public health research as of late. So for an example, there's research out there that connects structural violence, and they're using that concept, they're using that term when they're thinking about various different structures and practices or institutions that are in a society that's preventing people from being healthy or meeting basic needs. And people have been using that term in research to study HIV transmission rates, the health and well-being of homeless populations, as well as adverse birth outcomes. Now, there has been an increase and an uptick in studies that have focused on food insecurity and related outcomes, and they're beginning to use that term structural violence. So my colleagues and I were particularly interested in exploring these studies and really trying to understand how other studies operationalize and measured structural violence in their food security research. So for an example, are they using, what sort of phenomenon, or what are they specifically studying when they're, saying that they're studying structural violence? So for an example, is it supermarket redlining? And if that is how they're defining it and how they're studying it in that particular study, what sort of measures and tools are they using to capture that in their particularly their quantitative research? Also, it could be access to food pantries, gentrification, whatever term. So we're interested in exploring that broadly and thinking about how taking this information, synthesizing this information can be used to develop future directions for our field, but also help us possibly in our ability to measure structural violence and even food security. So that's the specific aims of our grant. So our grant has two specific aims. So far, we've worked a lot on the first aim. So I'm going to talk about where we are with that, because we're still working on the first aim, and then our plans for the second aim. So our first aim is we're going to conduct a scoping review. So like I said, we want to explore prior studies that have done this work to see what they have found. So we wanted to conduct a scoping review of peer-reviewed scientific literature published since 2000 to summarize how prior studies define and measure structural violence to study its influence on household food security. So the goal of this is to synthesize a list of structural violence measures and corresponding measurement approaches, so we can get an understanding to see, what sort of tools are out there and what measurement approaches have been done in the past. The next thing would be to develop a conceptual framework that describes how all these measures that we found across these studies that represent structural violence, how they come together, influence one another, and then ultimately influence household food security. So the goal of this particular part of the project is to generate a list of future directions for the field. So again, this is very foundational work for us to understand, okay, how can we advance the field's understanding of structural violence, which is a very broad term. And I know it could be very different, depending on whatever outcomes you're studying. how can we generate a list of future directions that highlights opportunities for advancement in research, but then also highlight opportunities for us to advance how we measure structural violence, and then ultimately possibly how we measure even food security. So starting with the scope and review, let me walk you through what we've done so far. So we have a trained librarian on our team, that's Mr. Bianchi. So I work with Mr. Bianchi, and we did a preliminary search of some papers in PubMed to develop a search strategy. So our search strategy is available in the appendix of our working paper that we distributed. So if you want to take a look at that, we welcome you taking a look at our search strategy. To look for relevant scientific literature in 5 databases. So we have them listed here. We have PubMed, Scopus, PsycInfo, CNOW, as well as Social Science Index. Okay, so after we developed the search strategy, translated across the databases, we ran the searches, and then we had 2 independent reviewers on our team to go through the titles, the abstracts, and the full text of all of our papers to apply our search criteria. So this is our search criteria. So we wanted to focus on peer-reviewed published papers, like I said, that were published in the year 2000 or later. So we wanted to try to have a recent batch of literature. We wanted to focus on US-based studies. And the reason for that is because, we're thinking about, structural violence in the United States. And historically, that has likely manifest very different in the United States because our histories with racism, sexism, classism is different than other countries. So we wanted to focus on US-based studies. Our initial approach to this, and I'm going to talk about this later on, is that we want to focus on quantitative studies because we really wanted to understand what measures, what tools were used to assess structural violence and in these prior studies. The next 2 criteria that are applied, we really wanted to focus on studies that looked at least one relevant independent variable that's relevant to structural violence. And then for the outcomes, they need to have at least one relevant dependent variable. So I'm saying relevant because due to the low number of papers that we located that fit these initial criteria, particularly the quantitative piece, we decided to expand that term. So they might not been using the term structural violence. They might have used another term like structural racism. They might be saying gendered racism. So this was actually, some of the feedback we received from the initial proposal was that we want to expand our understanding, and we look in terms of the list of what we were searching for specifically. And then also the preliminary searches found that, there's not many quantitative, again, that fits that outcome where the outcome is food security. So we actually expanded that to look at some other nutrition outcomes as well. And I'm going to talk about that. So this is just a working flow chart for what we've done so far. So, when we ran our searches, we started out with about 3,000 citations. And then after removing duplicates, we ended up with about 2,000 citations. After going through titles and abstracts, we excluded most of them and ended up with about 201 papers that we actually went through for full text. And we ended up excluding so far 160 of them based off our criteria. And so we have 41 papers that are still under consideration, still having discussions about exclusion and inclusion. And what direction we want to go in. I'm open to any discussion at this point. Anybody have questions or thoughts about this? But yes, we're down to 41 papers. And then after this, we're going to do the data extraction, synthesis, and then summaries. So I have some of the reasons why papers have been cut so far, many of them being that they're commentaries and they're qualitative studies. So we've actually identified a number of wonderful commentaries as well as wonderful qualitative studies. I know for a fact some of them were written and co-authored by people who are participating in this event. I know for a fact because I took a quick look at the participant list. Like I said, and so that's two of the key reasons why they've been excluded so far. Also, we've had some that were not US based, and then also their variables did not fit. Going through their variables, they did not fit our criteria. So out of the papers that we have remain, like I said, we have 41 left in the stack. As you can see, what we wanted to do was that we're trying to think of a way we could possibly summarize the findings or think through how we're going to present the findings. So one of our initial thoughts and approaches was to actually take these studies and actually put them into these domains based off what they're focused on in terms of structural violence. So for an example, if they're focused on understanding how people are being limited or being disadvantaged due to their race, they fall into this category. Same thing for socioeconomic status. We have ethnicity, intersectional, which I'm going to describe what that means in the next slide. Geography, that's based off where they live, sex, and then nationality, and that's really based off immigration, like their immigrant status. These numbers don't add up to 41, and that's because some papers fall in multiple domains. So there are studies that I know for sure are in the race, like they're looking at race and they're looking at socioeconomic status separately. If they were looking at the intersection of the two, they will fall into intersectional. So if you look at the working draft of the paper that we distributed, I actually put together an aggregate summary of some of the structural violence measures. This is just a select group for this particular presentation. But as you can see, the challenging thing about this is that we really want to focus on how they described the phenomenon and how they described the measure and what terms they were using and what measures they were using or what tools they were using. So as you can see, there's a lot of variation across the studies, which is going to make it very challenging for us to think through how we're going to present the results, but that's something that we're actively working on. So as you can see, we have everything in the stack so far from, we have perceived racial discrimination, we have perceived colorism, we have neighborhood racial segregation, we have supermarket redlining, housing discrimination, we have housing redlining, block busting, gentrification. And again, they're in this race category because they're looking at people being limited based off of their race. Like I said, we have socioeconomics as a key domain, geography, and then the intersectional papers. So this is looking at the intersection of the two. Like for an example, the diminished return theory. For this particular paper, they're looking at racial ethnic differences in educational advancement and opportunity, and looking at how, being a racial ethnic minority and having higher education limits, your health is not, your health is not, you don't have the same return on investment, even though that you're at the same level of education compared to somebody who is not a racial ethnic minority. So that's the diminished return theory. Very interesting. So if you want to look at relevant outcomes, so as you can see, based off the 41 articles, the outcomes fall into these categories that we have still in the stack. So we're still making decisions about, whether we're going to cut things based off outcomes. And again, we wanted to broaden the outcomes for the paper just because we had very few. Like I said, these are, again, the quantitative studies. These are not the qualitative studies. The quantitative studies where the outcome is actually food security status. So we have 4, and I'm going to talk about those in a minute. 3 of them fall into the race domain. 1 falls into the socioeconomic status domain, but we have malnutrition, we have access to different food retailers, we have outcomes looking at diet quality, healthy diet, food intake, something related to food purchasing or food acquisition. And then we actually have a lot of papers that focus on some type of eating disorder. So we're trying to make a decision whether or not these are going to stay, if they're relevant or not. But we also have some decision making to make regarding the structural violence measures and whether they're relevant or not. And I'm going to talk about that in my discussion points. So just wanted to quickly, highlight the 4 studies that we did find where the outcome is actually food security, or that's at least one of the outcomes that they studied. And as you can see, the measures that they use are very different across the board, different tools. This one actually used no scale. They just asked questions, but it's not like an actual validated scale. But all of them found significant results. Like they've linked, whatever they're focused on to food insecurity. So I'm going to wrap up so we can move on to the next presentation. So far we've identified a few quantitative studies that examine food security as an outcome, but like I said, we were open to some other relevant outcomes as well, just because we have such a low number of quantitative studies. Most of them fall into that race and socioeconomic status domain. There's a wide variety of measures and data collection tools that we've seen, and that's going to make it very challenging for us to really understand or look at compare findings across studies. So we have some ideas, and we were thinking about how we're going to finalize our stack. we want to look at all of the different structural, all the different measures, like go through them in detail, because we feel like some of them might not truly represent structural violence. Some of them might be more so like individual interpersonal experiences with racism or sexism, when we're really trying to look at societal structures and issues that lead to that truly represent structural violence. We do have a large number of qualitative studies in our stack, and to be totally honest, the qualitative studies are very rich. They have a lot of interesting findings, and I honestly think that they truly represent like what we're trying to study. So we're actually thinking about, actually doing something with the qualitative studies. I don't know if this is going to be part of this paper, but maybe a whole separate paper in itself. Yes, so thinking about expanding our scope to really think about the qualitative studies, so we can come up with a solid list of various different measures and constructs, so we can use that to build out our framework. So I just really want to acknowledge the leaders of the program, Park and Irma, for all of the advice they've given me so far with this project. And I also want to recognize our funding. And if you have any questions, please email me or connect with me online. Thank you.